The following presentation is a production of Ride the Wave Media.
It's the Best Birth Podcast, where we interview experts that elevate you as you prepare your heart and mind to have the best birth.
Each episode will interview professionals so you are prepared for pregnancy, birth, and postpartum. Our experts will build your confidence and empower you to trust your intuition throughout your pregnancy.
This audio is taken from videos on YouTube. Watch the entire episodes on YouTube at Birth Made Mindful. Welcome to the Best Birth Podcast. Here on our episode today, we have Sarah Watkins from the Baby Hive, and we are going to get into the weeds when it comes to our postpartum care, our newborn infant care, and how we can all survive these very challenging weeks and months.
So excited to have you, Sarah. Sarah's doula service is born out of gratitude for the care she received during her birthing and postpartum experiences. As a leader in the industry, Sarah has worked in maternal newborn health for 26 years and has been a part owner of the Baby Hive for the last 8 years. As a wife and mother of 5 children, she empathizes with your needs and offers tried and tested strategies for success. In addition to her doula training, Sarah's extensive hospital experience has taught her to think quickly and respond calmly. Sarah finds humor, joy, and adventure in all seasons of life. She loves supporting families and provides continuing care to support through antepartum. She also helps in labor, delivery, and postpartum. Since your needs don't end at the hospital, Sarah's wise and insightful approach eases your transition into parenthood. Sarah lives in Mill Creek with her husband and children. And we'll just jump right into the first question. We want to hear what is the difference between a postpartum doula and a birth doula? What is the difference?
So a birth doula is primarily focused on the labor and birth of the baby. So she's going to meet with parent or parents prior to delivery. She will accompany them to the hospital, the birth center, or just come to their home if it's going to be a home birth. And she's there to provide emotional, physical, and informational support throughout the process. Her care, although there's generally scheduled a postpartum visit. Those visits are focused on, oftentimes I'm just kind of processing the birth. There's a check-in, tell me how you're doing. But the care usually comes to an end after the baby is born. Within a couple hours is usually the duration that she's there for. A postpartum doula picks up the baton from the time after the baby is born and then onwards up to 6 months. And so she'll meet with the parents prior to the delivery to come up with a plan for them, strategize the plan for success for that transition. She'll go over them what's most important for them that they want to focus on in their postpartum period. She comes to their home, provides both day and overnight services depending on the preference of the parents. And she's there likewise, just like the birth doula, to offer informational, physical, and emotional support and resources to the client as well.
It sounds like the dream, the person that we all want when we have that newborn baby and we've had those feelings of dread, like how can they send me home from the hospital? Feeling like you don't know anything, just having an extra person to kind of bridge that gap. That's amazing.
Yes.
What got you interested in this line of work?
Well, I kind of think I sort of stumbled into it. Although if I look back just a little bit further, I can see the preparations that were in place, that my life was kind of leading down that path. But about 26 years ago, there was a position that opened up on labor and delivery for a certified nursing assistant, which I was at the time. And they were piloting a new program of introducing CNAs onto labor and delivery. Up until that point, it was labor and delivery at that time was a very difficult place to get your foot into to work. And it continues to be so, but even more so at that time. And so I just applied for the position, and it changed just my whole trajectory and my career path. And I worked on that floor for 7 years and had my babies on that on that floor. And after the birth of my first son, I mean, I admired these women and men that I worked with. I saw them in some of the most challenging circumstances, and had stood beside them as a team member. But now I was on the receiving end of that care. And it was very specialized, as you can imagine, when you birth with your colleagues, know you and you know them. And that bond of trust was tremendous. You know, to be with people literally held your life in their hands. Yeah. And they did it with extreme care and tenderness and skill. It wasn't the easiest birth. That first one was a cesarean, and it was not what I had planned. I was able to go through it and even look back on it fondly because of the way that I was treated. And I knew that all along the way, my choices were respected. I was advocated for. And so when I came back to work on the floor after having my first son, I looked around to every parent that was walking in the door. I thought, I want them to feel what I felt. I want them to experience what this was like. But, as many of us come to know, our model of care just isn't structured in a way that supported that. Yes. We do our very best to offer that personalized care, working on as staff members of labor and delivery. But they're spread thin. And they have so much, they have a lot of technical things that they are responsible for. And so it would be at least a couple years before I found the role of the doula. And I say it was at least a couple years because up until that point, whenever I saw doulas come on the floor, and it was few and far between. And basically, the only thing that I really knew about them was that when they were on the floor, I wasn't really needed in the room that much. My assistive care wasn't as greatly needed. One day I came into a room and saw this woman. I saw that the mother was nearly complete and getting ready to push, which was usually, okay, there's a lot of moving parts here, and it's a pretty well choreographed event of the birth team, and myself being part of it. So I poked my head in to assess where I might be needed. There was a palpable difference in feeling in the room as I came in. That she's almost complete, but this woman is so calm. Mm. And standing beside her was this short little woman that was speaking softly to her and was guiding her, and they're gently swaying, back and forth. And I stood there for a minute just trying to assess what it was that I was seeing. And so I came out of the room and I asked somebody, are we sure on those measurements? And they said, yes. And I said, well, who is that woman? And so I was told who she was, and she actually went on to become my mentor. She's a nurse of over 30 years and a labor and delivery nurse and a clinical hypnotherapist. And so that kind of coming to know that just changed everything for me. I thought, I want whatever she's doing, and I want to do whatever she is doing. And then when I took my formal training and the first birth that I attended with another doula who became another mentor for me, when I went to the first birth with her, I thought, this is it. This is that personalized care that I've been seeking to be able to offer, but, working within a model that didn't really allow for it. So that's what started it.
That was just mesmerizing to hear. I love how you were able to connect with those mentors that then helped you help other women. That's beautiful. I understand that you teach classes to women on how to prepare for birth in a hospital. What do you wish you could have gone back and learned before your first birth?
Oh, that's a great question. What could I have learned? I knew so much. I can't really say that I was really lacking with, except for when it came to the postpartum period. When it came to birth, there was always more that I could have known of what I did. I could have gone more in depth, but I would say, uh, i- you know, even for somebody working in that environment and so comfortable with it and feeling like I know what I'm doing, I really didn't know what I was doing. You talk to birthing parents, and they generally all express the same thing, that they can feel a difference even as they're being wheeled down the hall, or as their birth team is leaving. There's a sense of something's changing here, and I'm feeling a bit less equipped. Um, and so I think if I was better prepared for what lie ahead, and instead of thinking, well, it's just going to be instinctual from here on out, like I'm just going to do what every parent does, which is supposed to be not like this isn't supposed to be pleasant, but that's just what it means to be a new parent. Like we all have this induction ceremony that we have to go through. And so I wish I knew that it didn't have to be that way, that there were ways that we could help.
Is there a specific element of the postpartum period that you feel the education is lacking?
Yes, it's bring more awareness to what parents go through. And it's so wonderful. I mean, now we have podcasts and we've got videos, and you have these amazingly talented TikTokers that will, they'll then from different perspectives and kind of role play in front of you so you can observe and go, oh, I don't I like that. I don't think I like that. I think I want more of this.
Is there an element of the education for that period that is kind of like a clear gap in what people don't tell you, right? Like if you have a mom or a sister or a really close friend that can just sit you down and say, this is what's going to happen. This is how long you're going to bleed. This is what you're going to experience physically, the cramping in your uterus. Like these are some of the things that you need to be doing. You need to be massaging the area. You need to be belly binding. Some of the things that I feel like you were saying, you're just kind of a little bit alone unless you have built up that knowledge, or unless you are lucky enough to have that postpartum doula that can come in and maybe guide you through.
So it's really okay. So the educational component is on both the awareness and those very practical pieces of information and having it organized. So taking a class is really important. I mean, and because of the internet, we've kind of become a DIY. Like we'll put together this mosaic, which is wonderful, but having it organized in a way that it trims down and it brings it down to truly what are the most important factors, and kind of tune out the noise, because that can be very challenging. The discernment factor of when we're looking at things and receiving that information from trusted resources, because there's a lot of chatter out there, and there's a lot that can embolden us sometimes in areas where maybe like less emboldening there and maybe more focus over here would be good. So yeah, I would say the classes, which I didn't take anything that really emphasized postpartum. A lot was focused on birth. And so even in my own childbirth education classes that I teach, I try to pack in a lot of information in a relatively short period of time and direct parents to resources that are trusted resources that way, particularly bringing awareness to all of the care providers that focus on postpartum care. Because, for somebody that that was pushing for 3 hours, and maybe they needed forceps, or maybe everything went great, but they're a few weeks out and they're experiencing incontinence. And they go, okay, my mother never told me about this. But knowing that a pelvic floor specialist is very important, and or somebody recovering from a cesarean, and understanding that, there are healthy, body mechanics to be utilized here, just even getting yourself up and out of bed. And so knowing that a physical therapist that specializes in post-birth recovery is important. But those are just a couple of those resources. And so planting it out there, saying, okay, let's talk about, when you think about postpartum, who are the care providers that come to mind for you? Okay. Oftentimes there's kind of a blank, like, uh, I don't know. I'm going to meet with my doctor at 6 weeks. So I guess that's a postpartum. Like, no, there's so much more, and you have lactation consultants, and you have both physical therapists and chiropractors that specialize in peri and postnatal care, which is tremendous. Acupuncturists and, all the like. So, yeah.
Yeah. And there's those two elements of care for yourself, care for your new baby. And oftentimes the care of the new baby kind of trumps the care for yourself because, they've got that pterodactyl cry, some of them, and others who need to eat around the clock. But in my own experience, I realized there's certain things that I've got to stay on top of. I've had to shower every day, maybe even twice a day, because I felt like if I didn't, there would be chafing. There would be discomfort beyond what I was able to manage. I knew that I had to take care of myself when it came to breastfeeding, because if I started to feel like there was damage to my nipples, all of a sudden, I'm not able to feed my baby 8 times a day like I needed to. And so, especially I think for my second and third babies, I really tried to prioritize how I took care of my physical body.
Yes. Infants are fantastic for advocating for their needs. They will let you know. And if you're not listening to begin with, they'll really let you know. Our bodies are interesting that especially when we're caring for an infant, that we can put off for a while. We may not recognize that our body is starting to cry. Our body is starting to wail, but we're like, I'm a mom. I have to take care of this baby, and this is my whole priority. But you can only do that for so long, and then the body revolts and it says, no way. It says, if you're not taking care of the nutritional needs that I have, well, I'm going to shut down production of that milk. And likewise, also the healing of, it could be an incision or just, overall healing. The body says, okay, we're going to slow this down until you listen. So having the key to that when it comes to self-care. So probably with your first one, it was more of a progressive learning that you did after that first one. And you recover and you look back, you go, we're doing this different next time. So we've made some progress that way. And then the second one, no doubt, we made improvements. And now the third one, I really got this down. I'm gonna do this. But if we could go back to that first one, there's nothing like learning through experience. But if you can learn from other people's experiences, that's huge. And so with that collective in mind, those collective experiences in mind, there are key things that come through that come through. And the biggest one is having a plan ahead of time. When it comes to birth, there's a lot of focus on a birth plan, right? And a lot of effort has been made throughout the years to bring awareness to the importance of a birth plan. It's tremendous. So much so that now hospitals request it. In the beginning, they kind of went, wait a second, because we're doing a huge shift. We were going from more of a patient provider, I'm the provider and I take care of you, to more of like, okay, actually need some buy-in here with your care, and a welcoming of the accountability that goes along with that. And so having a birth plan in place so that, we're receiving more of that personalized care has been a welcoming now that, it's standard. But now we turn our focus onto postpartum, where of equal importance is that postpartum plan. So strategizing how, okay, we say, well, maybe one of the improvements was my partner's going to be involved more next time. Okay, how is your partner going to be involved? Defining clearly what the responsibilities of each person are. Another thing is strategizing your coping skills. Birth and postpartum is really not a great time to develop new coping skills. It's not a time to, look on. Let me Google a list of all the coping skills and kind of pull some out that feel good. We really kind of have to go to what are our tried and trues, and there's no judgment, whatever that is. But having the conversation ahead of time, recognizing what each other's coping skills are, and giving permission for each other to utilize those skills within reason. So it might be going for a walk. It might just kind of be zoning out on Instagram, or it might be playing a video game or a basketball game, or something like that. But communicating with each other and saying, "Hey, I give you permission. And you give me permission." And there's a wonderful. This is a while ago. I was listening to Brene Brown, and I'm not sure which talk it was that she was giving, but she talked about how, somewhere along the lines, we got this idea that marriage is a 50-50 partnership. And while mostly true, overall, let's say overall, but on a daily basis, that generally isn't the case. So she said, some days sometimes it's 30-70. Sometimes, but she said the most important thing is that the sum part equals 100. So if both of us, which oftentimes is the case, you're 4 days into coming home, you wake up in the morning, you're looking at each other, and both of you have bloodshot eyes, and you just like, "Can you help me?" And the other person's like, "Can't you help me?" So strategizing so that on those days when maybe the sum parts don't equal 100 is, what are we going to do so that it does? And what we do is making sure that our nutritional needs are being met. We also have the physical needs of just, some rest, and the emotional aspect is there. And of course, we've got the practical of caring for the baby.
As we were talking earlier with, waiting to meet our needs, or just those infants that tell us their needs. I know for me, it took about 2 years to get to a place where I was working on healing my deep core and the pelvic floor therapy. And it was because my body was shut down. It was in distress. One thing that inhibited me was just the cost of paying for physical therapy and things like that. What are some barriers that people face to getting access to postpartum care?
That's a huge barrier. So I would say right now, our 3 biggest barriers are barriers to access are awareness, right? Do we even know that they're in pelvic floor specialists? And then there's financial. Many of these services are really only provided unless insurance is in there, and it's a self-pay. And these are not inexpensive services. And then the third is actually a labor shortage. We simply don't. Our agency, the Baby Hive, our most popular service is our overnight newborn care, sleep. We sell sleep. It's not hard. Everybody wants it. And our overnight care provider coordinator is so gifted, and she just juggles so much in the air with coordinating this. We're always meeting more people. There's always more demand for the service than what we're physically able to provide. So, and that kind of rolls it back even further. Like, well, we need an increase of providers, right? So I would say those are our three, maybe four that are there. Fortunately, great strides are being in these areas. There are some amazing people that that are passionate, have been working very hard um, to bring down those barriers of access. And what we're seeing now is insurance companies that are reimbursing for both birth and doula care. So it's not just, it's kind of under the umbrella of doula services. Um, and then we also have corporate benefits programs that are coming up. And there's another one which I apologize, I just recently learned about, and it was through a mental wellness provider of a program that you can gift the services to friends and family members. And I'll find out what that is and I'll send you guys the link. But there is a lot of effort in those areas going.
That's hopeful to hear that it's changing and things are getting better. What would you say is something that a woman can do to plan for the week after birth? Is there something tangible that they could take away? I know with the 48 hours, that's where baby blues could come in. Is there other things that they could watch out for?
Yeah. So first and foremost is educating themselves on what that week looks like physiologically, right? And depending upon the feeding method, be it breast or bottle feeding or a combination of both, once that placenta releases, the body starts the milk production. Starts the milk production in earnest. So prior to that, 33 weeks, the body is already producing colostrum. So that baby's first milk, but it really kicks it up into gear there. So those first 48 to 72 hours is primarily focused on the production of milk and meeting the need of the infant. And that is a communication between the infant and your body. And I don't know why nature put it together like this. Like, we have this incredible specialized system, but why it can't figure out that I have a 7-pound, 8-ounce body, little being inside of me. And when it was born, maybe it lost a little bit of weight, but not like just start producing for that. But it's really it's a demand that's going on. And so demand to meet the need. And so knowing that those first 48 to 72 hours is that, then we look at, okay, if I've got to have this communication going back and forth, I have to have pretty easy and often access. So maybe not planning on a bunch of people coming over. An interesting thing happened during, and we're going to go back many years now. So we'll go back maybe about 15 years ago, when the H1N1 virus was out, and restrictions were first put in the hospitals, very similar to what happened with COVID. There was a shutdown of no visitors, no children. Pretty much no children were allowed in the hospital. And the only people that could be there was usually your partner. Which made it kind of sad. I had my son during that time, but I'll tell you, it was the first time that I actually slept. Like, really was actually able to get some rest. Because even just the distant chatter out in the hallways from other people's families, that was quiet. But what they found afterwards was there was a dramatic increase in successful breastfeeding rates that happened just by limiting and saying, okay, this is because what else should we have to do? right? And when we're not doing that, and people are visiting us in the hospital, we're missing cues. We want to be polite, and so. And the funny thing is that everybody will kind of bring attention to the fact that the baby is hungry, but nobody's making the first move to get out of the room. You know, everybody's like, "Oh, that sounds like a hungry baby, so hungry." And you're like, "No," more out to give a pacifier, things like that. So we're interrupting that communication. In addition to that, is as you mentioned, Sarah, was like the cramping that's going to be happening. So being aware of that and understanding what is it, what's causing this cramping, what is the reasoning behind it. Well, where the placenta detached, we have this massive uh, wound that is exposed there internally, and the uterus needs to contract down to pinch off all of these blood vessels. Super important. So as that process happens, we're getting a lot of blood flow that's happening. So anticipating, okay, product wise, I'm going to need to have some pretty big pads. So making sure that we have supplies on hand to help during that time. So that's a big deal. And then let's say, even if you birth at home or in a birth center or in a hospital, when you come home, you're going to have some nutritional needs. And so making sure that either your fridge is well stocked or you have meals that are coming to your home is big. Those are just a few things. Yeah.
Yeah.
And all of that takes planning. So coming up with a birth plan that addresses each of these things is big.
And it's so important just to make sure that you've got everything in place and, you've got a backup plan in case your first plan fails. I love that you were talking a little bit about, just like the cues of the baby. So like if a mom is choosing to breastfeed, establishing that with every single child takes time. And so I remember with my third baby, he was not latching correctly and it was becoming an emotional situation. I was phoning lactation consultants, feeling very distraught myself. And it wasn't until a lactation consultant helped me realize this baby has never breastfed before. Maybe you have, but this baby has not. And so when you sit down next time with him, you are going to practice latching. You're not even going to feed him. You're just going to practice latching. And I said, well, how many times do I practice latching? She said 20 times per side. And I thought, you want me to practice 40 times? And honestly, that is what helped me to get him to latch. After his 7th attempt in latching, because I was able to calm down and practice instead of just sitting down for a feeding session, he finally caught on. And we never had problems thereafter, but it was my mental state and emotional state that was prohibiting his ability to feel like he could practice, right? Like he needed that understanding person to say, oh yeah, like I'm going to teach you, right? Like everybody says, well, a baby knows how to do it. A mom knows how to do it. And that's not necessarily true because each of you has to come together. And let's dive a little deeper onto this whole element of visitors or help for the family. Because oftentimes, a mother or a mother-in-law or a sister or a friend, they're coming and they're helping, but how can we, foster an environment so true help is taking place?
Everybody that you taught, with rare exception, especially within the people that are closest to you, it's not their intention to disrupt or to undermine the process of happening, but they do need some direction. And it needs to be brought into order for them so that they know that there are specific things. Like I would say, look at, and this is what I tell parents that are expecting the grandparents to come visit, is if they have specific tasks and you think about what are their strengths and where are their weaknesses at. If I have a mom if I have a grandmother, let's say my mom came, and I'm not saying this is my mom, but let's say my mom came to visit. And incidentally, the person that actually came in and helped take care of me was my dad. My mom was a school teacher. It was in the middle of the school year, and my father had just retired. So, he was a very nurturing person. So it just, I mean, I wasn't asking him any breastfeeding questions or, Dad, what do you think about this latch? That wasn't there. But what he did provide was sociality. I had somebody that would, in the morning, hey kiddo, how was your night? Or, let's go out to lunch and I'll help, But think about the people that are closest around you and do a careful observation of what their strengths are. And we want to play to those strengths. So if we have a friend that is that amazing friend, her house always looks incredible. Everything is, there's a place for everything and everything has a place. I'm not that person. Although it's interesting, I can do that for somebody else, but it doesn't translate at home. But that might be the one that that when they come, you might ask them to, maybe you had a rough night or something, and could you just go and look in the nursery and put it together? And it just makes sense. Just look around and kind of make sense of things, but having specific tasks in mind for the people that down to the, you can be as comprehensive or as simple as you want. Generally simple is good, and keeping the time frames down to, maybe about an hour, maybe even just 45 minutes, because you never know when that baby is going to need to eat. I mean, you kind of know, but anyway, but yeah, limiting the amount of time that they're there and playing to the strengths of each person.
That's so helpful. What do you do when you have multiples and it's not your first baby, or you have twins and there are other people around too?
Help. So, the fun thing with multiples is the novelty wears off real fast. And you just go, wow, this is a boatload of work. So it's two of everything, and it's juggling. But it actually kind of translates over. There's not too many things truly different in that regard. But something that is true about whether it's triplets or quadruplets or a singleton, we know that your sleep is a priority. Restorative sleep is a priority. So the person coming over with, and also recognizing too that when sleep deprivation kicks in, our executive functions just plummet. So across the board, taking care of a newborn is not really rocket science. But when we have incremental sleep deprivation building up, we'll look at something and go, I know this, I don't know why this isn't making sense, but it's not making sense to me. So planning for that dip in our functions is important, so that there's not as much of a task on our mental load. So having people come and, take care of the laundry, fold the laundry, put it away. I would say also, depending upon the feeding, it doesn't even matter which feeding method it is, but having a lactation consultant come in is really important. The interesting thing is that oftentimes people think of lactation consultants as something that is, if you need it, call on them. And you're going to know that in the moment. But this is actually a provider that can meet with you ahead of time. There's a lot of preparation that can be made, and a lot of individualized information that you can receive ahead of time. So we're not making panic calls. I can't get my baby to latch and the baby needs to eat, but wait, you mean you can't be here in 20 minutes? You can't come till Friday and it's a Tuesday? So having met with them prior to that, prior to the birth, is wonderful.
When we were surveying our circle and our friends to ask about podcast topics, it was an overwhelmingly large amount of people that wanted lactation support and breastfeeding suggestions. because it is an equally difficult experience as birth, but possibly a little bit less of like, oh yeah, everybody's going to need help. Everybody's going to need that provider, and more of like, oh, well, you'll figure it out. Like everybody does it, like your grandma does it, your mom does it. So like you'll get it, instead of realizing that it's a skill, it takes time, and it's going to take a lot of time.
It's so nuanced. It's so nuanced. Even when it comes to pump parts and phalanges, I didn't realize this, but there's upwards of over 20 different sizes of phalange parts out there. Me, as a postpartum doula, I thought, well, there's the standard. There's like 2 different sizes, but that's where know what you know and know what you don't know, and refer out for the things that you don't know. Have the awareness there and the resources to refer. And lactation is huge.
Yeah, I was not prepared for how painful breastfeeding was going to be. And I think a lot of times we see that with motherhood and birth. We see the highlight reel, we see the good moments. And it's only when we get that awareness, that education, that we really start to understand what it entails and how we can get the support we need to address it when it does come up.
Well, we love to share with our listeners some resources that they can go to. Do you have any resources that you would like to share, or that they can come to, you and your team for?
Sure. The Baby Hive. Our motto on our website has been to get the postpartum care you need before you need it.
Mm-hmm.
So the sooner that you engage with us, and if we're full, then we will refer out. We have some trusted colleagues that are wonderful. In addition to that, there's the Utah Doulas Association. Utah is a pretty amazing place. Like, we have a pretty extensive birth community of professionals, and the Utah Doulas Association is the largest and longest standing organization of its kind in the country. So that's a wonderful resource to go to and find different providers that are on there. In addition to that, and we haven't talked as much of it so far, but on the mental wellness aspect. So the greatest indicator, risk factor of experiencing a perinatal mood disorder, be it depression or anxiety, depending on how it manifests, is a previous experience of it. And that doesn't even have to be during pregnancy, but definitely if it does occur during pregnancy, then our risk factor goes up even higher. But having access to and awareness of mental health providers that are specially trained in supporting families of experiencing perinatal mood disorders. This is not limited to just the birthing person. Partners also can experience this. Now, they're not having the tremendous hormonal fluctuations that are happening quite the same way, but the number one preventative and the first line of treatment is sleep. So if we have a lack of that happening, then our risk factor skyrockets. So having an awareness and access to mental wellness providers and engaging those services prior to the birth of the baby is huge. You're so far ahead of the game if you can do that. And so there's a fantastic national organization called Postpartum Support International. Utah has a thriving chapter of this, and on their website they have a list of network providers that are specially trained. And it's not just in mental, but you'll find doulas on there. You'll find physical therapists. You'll find chiropractors. It's a great resource.
One of my favorite resources in preparing pretty much for anything in my life, whether it was dating or having my first baby, was reading and just checking out books from the library. One that I came across was called The Fourth Trimester.
Yes.
Such a beautiful piece of work. But she says, the fourth trimester is not about getting back to normal. It's about creating a new normal that honors the profound changes you have undergone.
Yes.
And I feel like that is exactly what we have touched on today, is just creating an environment in which we can thrive. It might not be the same as what it looked like before your baby entered your world, but it is so beautiful. And there's so many resources and people we can turn to for that support.
Yes. And speaking of support, we will share our Mom Squad secrets of the week. And this one, we have 10-year-old Olivier. His suggestion is clean up the house so mom is not stressed when she comes home with the baby. So, words from
That is a
the wise. Is there anything else that you felt like you wanted to share with our listeners before we leave?
There's one more organization, and I just saw this recently at the library. The United Way has a home visiting program, has a postpartum home visiting program that, it's volunteer based, but they're trained. Anytime you can have in-home care, that is a key factor when it comes to postpartum care. So any providers that will either do virtual visits with you or will come in to your home, it's so worth it. And United Way has a great program.
Yes, that's fabulous. I had a friend that had twins, and she decided that it was time to hire a house cleaner because she wanted to bring in that support, and she felt like it was time to justify it. And so she cut down her eating out bill a little bit so that she could afford that in-home care and help.
Yes, absolutely. Constant.
Sarah Watkins, thank you so much for joining me in the show. I know that our listeners are going to learn so much from everything that you have shared today. Thank you very much.
Thank you.
Thanks for joining us on today's episode. We hope you've been elevated and inspired by this week's expert.
Subscribe today so you never miss an episode. And please share our podcast or post on your social media so that other moms and dads-to-be can also have the best birth.
Please note that the information provided is based on the expert's insights and personal experience. It is not intended as medical guidance. Please seek the advice of your medical provider as it applies to your specific condition.